Hello, my name's Justine Munner. In this video I'm going to talk to you about trigger points and how we can treat them with dry needling. So trigger points, you've probably all had one at some point. It gives you that lovely achy pain. When you press on it, it feels absolutely exquisitely tender. In fact, in my treatments I quite often be referred to as having witch's fingers or something just as nice. They're involved in many pain presentations and are vital to treat if you want symptomatic relief of pain and restoration of normal movement. So trigger points are tight, localised portions of muscle. What do they actually do? So firstly, they make a muscle more tight. They reduce the flexibility within that muscle and make the muscle stiff and create extra pull throughout that muscle. What they'll do is put extra tension through the muscle insertion, through the tendons and into the bone. Therefore you can have all sorts of problems as a result of trigger points, such as a tendinopathy, like a tennis elbow or an Achilles tendinitis, or they can create extra compression over joint structures, such as aggravating things like achondroplasia patella, for example. So secondly, it can lead to movement dysfunction. If a trigger point is present in a muscle, that muscle cannot activate normally. It will feel very weak because the muscle's function is inhibited. It can also change the movement coordination patterns. So different muscles that should work together normally become altered. So the movement activation sequences actually change. Movements don't work at the right time and you can end up with other muscles compensating for the ones inhibited because of trigger points. This is really obvious in shoulder movements, where you get rotator cuff muscles with trigger points in them and the whole shoulder movement control goes completely out of the window. And thirdly, trigger points will generate pain. Some active trigger points have referral patterns of pain far away from where the trigger point actually is. The pain can be very nerve-like in quality and it doesn't tend to hurt when you press on the area. See this trigger point that's in infraspinatus. The cross is where the trigger point actually is, and the red area is where the pain is actually perceived. In this case, it's perceived in the biceps, the lateral forearm, and into the hand, completely far away from where the trigger point actually is.
So this is the theory behind trigger points. You can see in the top right, there's the overfiring dysfunctional motor nerve, causing the actin and myosin filaments of the sarcomeres to contract locally where the motor nerve terminates. This is, yes, you can tell that I don't have an art qualification. The structure below it is a blood vessel apparently, and as you can see where the local contraction is, that blood vessel is being contracted and compressed. That's restricting the blood flow and subsequently the oxygenation to the area. Because of that lack of oxygen, your energy supply in the vicinity goes down. Think about your Krebs cycle here. And because of the contraction, your energy demand goes up. Because you've got lower energy supply, increased energy demand, this results in what we call an energy crisis. So things start to work more anaerobically, and this results in noxious histochemicals that reduce the pH in the area. This reduced pH then irritates the nociceptive nerves in the area, and this irritates the motor nerve, which continues to be overly stimulated and continues to then stimulate the sarcomeres in response, completing the cycle.
Trigger points can occur in any muscle, but they have defined positions and defined referral patterns. The classification of active trigger points is the type of trigger point that will have a referral pattern of pain. A latent trigger point does not refer pain, but will still be tender when you palpate it and cause dysfunction within the muscle it's situated. So what causes a trigger point? Anything where the muscle is subjected to repeated overuse, such as a repetitive strain injury, can cause microtrauma and subsequently trigger points can form. A big old injury where you get a macrotrauma can cause a trigger point to form, probably trying to stop you from using the muscle while it heals. And anything where you end up with some kind of ischemia, where the blood supply and the oxygenation to the muscle is very poor. For example, sitting in an awkward workplace where you're in one position for a long time without moving, the blood supply to the muscle will diminish and you can get a trigger point or two. Check out video part 2 to find out how trigger point or dry needling can be used to effectively and efficiently get rid of these trigger points and save your manual therapist fingers.